Hello, my name is Lauren Villa, and I'm going to be talking to you about the healthcare policy in the Philippines and comparing that with the United States. The type of healthcare system. So both the Philippines and the United States have public and private healthcare systems. The Philippine government is moving progressively towards a universal healthcare system, which means that every person is covered for mostly all of their medical procedures. PhilHealth is the health insurance program used to cover all Filipinos, ensuring that they have quality and affordable healthcare services that comes with many benefits. On the other hand, the United States used Medicare, which is a federal health insurance program used to cover those over 65 years old, and they cover people with disabilities, which comes with many rules and regulations unlike PhilHealth. Both countries have perceived gaps between the rich and the poor. In both cases, the poor cannot afford this health insurance, meaning they are not receiving adequate medical care or treatment due to the high costs. The Philippines also need to address the widening gap in inequality among women in different socioeconomic statuses. Sadly enough, poor mothers are 5 times more likely to die from childbirth than wealthy mothers. Population health and infant mortality. First, I'd like to point out the graphs. As you can see in the Philippines, there is a steady decline up until 2014. Then it skyrockets in 2016 and 17. In the United States, it has been a steady rate all along from 2000 to 2017. The infant mortality rate in the Philippines is almost 4 times higher than it is in the United States, with 21 deaths per 1,000 births in the Philippines and 6 deaths per 1,000 births in the United States. That is due to lack of sufficient medical care throughout the whole birthing process, with increases the complications and infections that could spread. Breastfeeding is also very important in a child's first 6 months of life. And in the Philippines, 1 in 7 infants are not breastfed. Lastly, closely spaced births are more prominent in poor Filipino women. Studies show that children born less than 2 years apart are twice as likely to die at 1 year old than children born 3 years or more. In the United States, infant mortality rate has declined so much due to safe sleep practices, such as having a baby sleep in their own space, on their backs, and free from things such as blankets, pillows, and toys. Healthcare spending and total healthcare spending per capita. In the Philippines, they spend about $6,000 on healthcare spending per capita, which is significantly less than the United States does, who spends about $9,000. About half that spending comes from out-of-pocket payments for things such as medicine and hospitalizations. The more money in the United States spends does not necessarily mean they have better health outcomes. This spending is so high due to higher costing goods, the use of expensive medical technology causing prices for healthcare services to be much higher. Healthcare systems and preventable deaths prior to age 75. Preventable deaths prior to age 75 in the Philippines is higher than it is in the United States. In the Philippines, more males are dying from preventable deaths than women are. Road accidents are actually a major cause of death in males aging from ages 15 years old to 19 years old. In the United States, there was a fairly large decline in preventable deaths due to drops in death rates from ischemic heart disease. Public and health prevention and tobacco control efforts in both the Philippines and the United States. The Philippines is the strongest tobacco lobby in Asia and has one of the highest per capita levels of cigarette consumption, and about 30% of the adult population in the Philippines currently smoke, and sadly enough, 11% of the minor population smokes as well. Tobacco kills around 88,000 people per year. making it a total of 240 deaths every single day. The World Health Organization is trying to encourage the government to increase tobacco prices and tax them to enhance tobacco control. This current issue is being addressed by the President Duarte, who implemented a strict ban on smoking that stated that tobacco cannot be sold near schools. And in the United States, 15 of every 100 adults currently smoke, making tobacco the largest preventable cause of death and premature death. While in the Philippines, the current issue addressed is cigarette smoking and children, the U.S. is addressing the issue of current cigarette smoking with those living with HIV. Adults with HIV smoke 3 times greater than someone without HIV. HIV positive people are at a higher risk of developing cancer, heart disease, and have a greater chance of their HIV leading to AIDS. Not to mention, they have a shorter lifespan than those with HIV who do not smoke. In this picture, as you can see, about 1,073 cigarette sticks are smoked per year. There is a total smokers range from 30% being male to almost 20% being female. And an estimated 10 Filipinos died every hour due to smoking-related issues. On to the next side of lead poisoning and in the physical environment. Lead poisoning is a huge problem in both the Philippines and the United States. It is very harmful to children. Lead poisoning in the Philippines is associated with the impairment of childhood cognitive function and abnormal behavior. Acute lead poisoning attacks the developing brain and central nervous system and can cause coma and even death. Children who survive these attacks are left with mental retardation and encephalopathy, which is a syndrome that can involve permanent brain damage. In the US, lead poisoning is less common than it was in the 80s because lead was taken out of products such as paint, and then there was a mass cleanup of lead in homes and soil. There's a large issue with lead in cases that go undetected today. These cases have significantly high poisoning rates and are usually in poor minority areas located in the south and the west of the United States. Access to care and the rate of uninsured. Of 94 million citizens in the Philippines, 8 million are uninsured. So in 2014, it was mandatory that people over the age of 60 must obtain coverage. Insurance is highly recommended so that people do not have to pay extremely high fees. There are about 11% of adults in the United States still uninsured. States that choose to expand with Medicaid saw a 7% decline in the uninsured. Those who are uninsured typically have been without coverage for a while and are families in low income and non-elderly. Violent crime rates. The most crimes seen in the Philippines are categorized as index crimes, meaning that they are serious and frequent. Crimes such as homicide, murder, rape, and robbery all fall in that category. The President of the Philippines said that illegal drugs are the culprit of most of the crimes that occur and has implemented a war on drugs, which has led to a drop in the crime rates by 13%. In the United States, for every 1,000 people, there are 41 crimes committed, with the majority of the crimes going unreported. Some key takeaways, and overall, the main points you should take away from this presentation are that both the Philippines and the United States have a mixed healthcare system. The United States spends a lot more money than the Philippines, and tobacco is a main cause of death, both in these countries. In conclusion, the Philippine healthcare system has been progressively moving towards a universal healthcare system. There are large gaps in both the healthcare systems between the rich and the poor, and both Philippines and the United States have addressed the current issues today with tobacco control efforts. A major difference between the Philippines and the United States is how infant mortality rate is a major problem, more in Philippines. On my last slides, I have my references, and thank you so much.